let's cover one of the, actually not one of, the most important category of prognosis. Now, we talked about how to give a prognosis, what it's based on, all that. There's one category that's the single most important category in prognosis. Matter of fact, it's the single most important category in your narrative report. So remember we said the two most important categories in personal injury is an impairment that causes restrictions or limitations with activities of daily living. So that's the deal. That's the pinnacle of personal injury, okay? But you want to connect your prognosis to long-term care. Well, that's what a prognosis is what that they need care. But you want to connect it and show that it's periodic, it's going to get worse, and it's going to create a much larger problem down the road. In other words, you want to connect altered biomechanics here to the number one disability in the United States right here, osteoarthritis and a debilitating condition. That's what you want to connect. Okay? So let's go into that a little bit, all right? Because what if I just say, well, they have this problem, they're going to need this care, periodic, over a month, and that's it. Well, that'd be fine. If you just did that, you'd be okay, right? But what happens if you go, they're here, this is what they need now, but as time goes on, it's going to get worse, 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 and worse, and it's going to lead to a serious big problem down the road. Is that more valuable? That's where you want to go. So you want to connect altered biomechanics, because that's what altered biomechanics does. It's the number one precursor to the number one disability. By the way, why do I say the number one disability in the United States and not just arthritis? How much more impactful is it when I say the number one disability in the United States? So I'll say arthritis, but what will you always hear me say with it? The number one disability in the United States, because what does that do to the impact of the word arthritis? You see how it works? 1 in 5 adults have arthritis. Did you know that? 1 in 5. It's the highest prevalence. Okay? Now, work backward. What's the number one cause of arthritis? Well, there's different types of arthritis, right? Of all the different types of arthritis, on a percentage basis, which one is the largest? Osteoarthritis. Okay? What is the cause, the origin, root cause of osteoarthritis? Major trauma or minor trauma. Macro trauma over time causes arthritis, right? Either major trauma or macro trauma over time, right? But we're talking mainly about low impact soft tissue spinal injuries. So we're talking about macro trauma. Okay? So you want to connect the MMI impairment and the prognosis, the need for cure. That's the starting point to this debilitating problem. The number one disability in the United States, osteoarthritis. That's what spinal osteoarthritis. So what are some stages in between that we might say? Let's simplify it. Well, the origin is major trauma. That's the origin. Next, altered biomechanics, abnormal movement of the spinal bones. We already got that documentation, right? We've already got that documented in all the different ways, subjective, hybrid, joint motion, all that, okay? So let's go to the next step. What might be the next step after altered intersegmental motion? Premature wear and tear. On what? I'm going to list several of the tissues. Premature wear and tear on what? Cartilage, bone, increases ligament laxity, doesn't it? The more you wear the bone out, does the ligament become tighter, stay the same, or looser? Looser. What's that do to? Okay, so I'm just going to say, I'm going to name the tissue. So altered biomechanics causes premature degeneration, wear and tear. On which tissue? Cartilage, bone, ligament, tendons, muscle. I'm just going to name the tissue. And then I'll say a little bit about each one, real short. This is in the narrative report. And by the way, what I'm sharing with you now is copy and paste. It's copy and paste. In other words, the pathology of altered biomechanics is copy and paste, just like the 3 phases of healing. I'm going to have, 3 or 4 stopping points that I talk about. So, cartilage, it'll increase the degeneration of the cartilage. Bone, it'll increase the stress on the bone, creating osteophytes and spurs. Pain receptors, altered joint motion stimulates pain receptors, causing pain. Ligament, degenerative changes in the joint decrease the joint space, causing more ligamentous laxity. See how quick and simple this is? Muscle tendon. Muscles and tendons are going to fire, causing more hypertonicity and spasm because of the pain sensors that have been stimulated. The response to the pain will be hypertonicity and muscle spasms. Did I leave anything out? I covered cartilage, bone, ligament, muscle tendon, and the pain receptors. Those are the top 5, right? Are we okay with that? How simple was that? I didn't exaggerate it, did I? But it's true. What I just said was true, wasn't it? Okay? So I'll say that. And then I'll add another stopgap. I'll say, and that is what's going to lead to severe premature degenerative changes. The number 1 disability in the United States, osteoarthritis, and possibly leading, and I'll go into 3 major categories, and increasing the restrictions or limitations with activities of daily living, possibly increasing the patient's need and requirement for medications and analgesics, and as it continues to degrade and get worse, possibly increasing the patient's need for joint surgery. ADLs, medications, joint surgery. That's where it'll end. I just laid it out for you. What I just told you is the most important thing in the narrative report. And by the way, did I have all the documentation to support everything I just said? Did I? Yes, I did. Is it not true? You guys know it, you're chiropractors. You see this all the time. You see patients in all these different phases every day of the week, don't you? From different phases of injury, where they're at. Now, I'll use the 4 stages of arthritis, and I'll say the patient automatically jumped into the 2nd or 3rd phase. If they already had some degeneration prior to the injury, they'll automatically jump into the 3rd phase of spinal osteoarthritis. If they had no spinal degeneration, they'll jump into the 2nd phase. So when they already have a little bit of degeneration, they've already gone right into the 3rd phase of spinal degeneration. That's how quickly they've accelerated it. There you are. But that little synopsis is what's in every narrative report. It's typically copy and paste, and that is the end game of the prognosis. So I told you how to get the prognosis and the need for care, right? So the end game of prognosis is that right there. This is how this low-impact soft tissue spinal injury leads to the number 1 disability in the United States, osteoarthritis, with high probability increasing the patient's need and reliability on frequency of prescription analgesics, increased restrictions and limitations with their activities of daily living, and if it progressively degenerates and gets worse, possibly surgical intervention. That's what it sounds like. How easy was that? Pretty straightforward and easy. I would just print out what I just said, clean it up, just print it out. That's going in all my narratives with people that with all the patients who have MMI, altered arthrokinematics. That's going in every narrative report because it's totally true. Now, which phase they jumped into depends on the patient. Did they jump into stage 2 or 3? But that is the single most important thing you're going to have in the narrative report right there.